Hi everybody. The moment you hear somebody who's had a stroke, stroke, one side weakness or one complete side paralyzed, what comes to your mind? Somebody in your house, father, mother, brother, sister, neighbor, auntie, uncle, somebody paralyzed, rushed to hospital, ICU, months to weeks, in bed, never completely recovered, either bedridden, half speech, half hand, half leg. All that comes to your mind. Some of them even die, right? Most of it is gory details, negative feedback, and poor outcomes. What if I told you that there's a patient who had a stroke, one side, completely left side paralyzed, and he went home walking in 1 week's time? Magic? Magic? Accept it? You think it's possible? Hi everybody, my name is Dr. Sharan Srinivasan. I'm a stereotactic and functional neurosurgeon and not a magician. But I will tell you the importance of magic in acute care, in emergency situations, in neurological treatment. This patient, a young guy, came with a one-side weakness but rushed to the hospital in a very short time, within half an hour to 45 minutes of having a stroke. He came to our hospital, Bhagavan Mahavi Jain Hospital in Girinagar, which is a stroke-ready hospital. That's critical, a stroke-ready hospital. He came in, our stroke team got in, we got the imaging done, we realized he was a stroke in what we call as the window period. You have other videos on this series which tells you exactly what is the window period, what do we do. If you do not know about it, go search in a YouTube channel. There's enough of stories about what is the window period. Okay, I'm going to ask you questions next time. Did you look at those videos? Okay, coming back to this guy's story, he was in the window period. We decided he needed a special angiogram related procedure, what we call as a mechanical thrombectomy. My colleague Dr. Bhaskar, who's an intervention radiologist, rushed in and he did what it is, and within 7 or 8 minutes, I think maybe something like that, the clot is out. And lo and behold, a guy who could not move his limbs 8 minutes earlier lifted his hand immediately after that. That's how magical it is. That means if we do the timing right, if we give the right treatment at the right time by the right specialist in the right institution which has the right setup, the results are magical. And that's what I want you guys to understand. Stroke is not a hopeless situation. Like how the heart attacks have become magical like this, people rush into hospital, they do the stent, they do this, they do that, and patients get better. We want the same level of impact, same level of outcomes, even with these strokes at that what we call now as brain attacks. So ladies and gentlemen, don't lose hope, but key is to identify the symptoms of the stroke, something called BFAST, B-E-F-A-S-T. Again, please go back to our episodes or videos on BFAST and see what BFAST is all about and learn about it, mug it up. This is worth mugging up. Practice it, look at what it is, how it is, so that you don't panic and forget when you are in an emergency. Pick up the signs and symptoms of stroke fast, go to a stroke-ready hospital, get the right kind of treatment done, agree for it, and the results are magical. Don't forget.
39 ಏಜ್ ವಾಮಿಂಟು ತಲೆನೊಂದು ಬಂದಿಲ್ಲಿ ಇದು ಭಗವಾನ್ ಮಹಾವೀರ್ ಜೈನ್ ಹಾಸ್ಪಿಟಲ್. ಆಲ್ರೆಡಿ ನಮ್ಮ ಫಾದರ್ಗೂ ಇಲ್ಲೇ ಕನ್ಸಲ್ಟ್ ಮಾಡೋದು, ಅಮ್ಮಗೂ ಇಲ್ಲೇ ಮಾಡೋದು. ಹಾಗಾಗಿ ನನಗೆ ಬಂದೆ ತಲೆನೋವು ಅಂತ. ಬಟ್ ಅದೇನಂದ್ರೆ ಇದು ಕೋಲ್ಡಿಂದ ತಲೆಯಲ್ಲಿ ಬ್ಲಡ್ ಕ್ಲಾಟ್ ಆಗಿದೆ ಅಂತ. ಆಮೇಲೆ ಅವ್ರಿಗೆ ಗೊತ್ತಿಲ್ಲ, ದೊಡ್ಡಾಗ ಅಡ್ಮಿಟ್ ಮಾಡಿದ್ರು. ಅಡ್ಮಿಟ್ ಮಾಡಿದ್ರು, ಮೇಲೆ ಅಡ್ಮಿಟ್ ಆಗಿ ಸಿರೋಗುತ್ತೆ ಅಂದರು. ರೂಮಲ್ಲಿ ಶಿಫ್ಟ್ ಮಾಡಿದ್ರು ಅಷ್ಟೇ, ಇಮಿಡಿಯೇಟ್ ಸ್ಟ್ರೋಕು. ಈ ಕಾಲು ಬರಲೇ ಇಲ್ಲ. ಎಮರ್ಜೆನ್ಸಿ ಆವಾಗ MRI ಮಾಡಿದ್ರು. MRI ಮಾಡಿ ಅವರು ಭಾಸ್ಕರ್ ಸರ್ ಒಬ್ಬರು ಸಲಹೆ ಮೇಡಮ್ ಆಪ್ರೇಷನ್ ಮಾಡಲೇಬೇಕಂತ ಓಕೆನೂ ಮಾಡಿದ್ರು. ಆಪ್ರೇಷನ್ ಮಾಡಿ ಜನವರಿ 14, 2024 ಬಂದೆ. 5 days ICU ಇದ್ದೆ. ಇಲ್ಲಿಗೆ ಇದು ವಾರ್ಡು ನಾವು ಮಾಡಿದ್ದೆ, ಜನರಲ್ ವಾರ್ಡು. ನಾರ್ಮಲ್ ಆಗಿದೆ ಈಗ ಡಿಸ್ಚಾರ್ಜ್. ಅಲ್ಲಿ ಐಸಿಯುಲಿ ಜನರಲ್ ಮೇಂಟೈನ್ ಮಾಡಿದ್ರು. 10 years ಸ್ಮೋಕ್ ಮಾಡಿದೆ, ಡ್ರಿಂಕ್ಸ್ ಬಿಟ್ಬಿಟ್ಟೆ. ಸ್ಮೋಕ್ ಮಾಡಿದ್ರೆ ಬಿಡಕ್ಕೆ ಆಗ್ತಾ ಇರಲಿಲ್ಲ. ಸುಮ್ಮನೆ ಟೆನ್ಷನ್, ಹೆವಿ ಟೆನ್ಷನ್. ಟೆನ್ಷನ್ ಆದಾಗ ಒಂದು ಸ್ಮೋಕು ಒಂದು ದಿವ್ಸಕ್ಕೊಂದು ತಗೊಳ್ಳೋದು. ಹಾಗಾಗಿ ಸ್ಮೋಕ್ ಜಾಸ್ತಿ ಮಾಡಿ ಈ ಥರ ಆಯಿತು, ಸ್ಟ್ರೋಕ್ ಹೊಡಿತು. ಈಗೆಲ್ಲ ನಾನಾ ಬಂದಿದ್ದೀನಿ ಉಳ್ಕೊಂಡಿದ್ದೀನಿ, ಇಲ್ಲಾಂದರೆ ಮನೆಯಲ್ಲಿ ನೋಡಿದ್ರೆ ಸ್ಟ್ರೋಕು ಜೊತೆಗೆ ಹೀಗೆ ಮಲ್ಕೊಂಡ್ಬಿಡ್ತಿದ್ದೆ. ಇವರೇ ಆಶ್ಚರ್ಯ ಅಂತಾರೆ, ನೀವು ಬಂದೆ ಮನೆಗೆ ಹೋಗಿಬಿಟ್ಟಿದ್ರೆ ಆ ಟೈಮಿಗೆ ಬಂದು ಮಾಡಿದ್ರು. ಅಂದರೆ ಯಾರಾಗ 100% ರೆಫರ್ ಮಾಡ್ತೀನಿ, ಬನ್ನಿ ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ. ಇನ್ಶೂರೆನ್ಸ್ ಇದೆ, ಶೈಲಜಾ ಮೇಡಮ್ ಏನು ಶೈಲಜಾ ಮೇಡಮ್ ನಮ್ಮ ತಾಯಿ ಥರ ಚೆನ್ನಾಗಿ ನೋಡ್ತಾರೆ. ಅದೇನು ತೊಂದರೆ ಕ್ಲಿಯರ್ ಆಗಕ್ಕೆ ಬಿಡಲ್ಲ, ಆದರೆ ಕ್ಲಿಯರ್ ಮೌಂಟೇ ಕಳಿಸಿದ್ರು ಅಷ್ಟೇ.
This is one special case of stroke who has undergone the right time neuro intervention, has made best recovery. So a young man, we call it as a stroke in young, before 49 years of age. This guy is like around 34 years old, has come with a history of stroke in the form of giddiness. This guy had a history of excess smoking and alcohol, and he is obese also, is around 104 kgs. So he has presented with the usual symptoms like posterior circulation stroke, we call it as, which affects the brainstem. Right time he had come, so we had diagnosed here in the Jain Hospital, Girinagar. So MRI showed there was occlusion in the vertebrobasilar artery. So immediately we took him for the intervention that showed vertebral artery occlusion extending to the basilar artery. So thromboaspiration is done. So that was fastest recanalization within 3 minutes, which is the fastest in the literature, available literature, and that has made him a good outcome with an on-table recovery, and at the time of discharge he was able to walk normally and talk normally. Otherwise, this part of the brain, where brainstem we call, if that part of the brain gets occlusion or whatever the arrest in the circulation to that part of brain is maximum, like it may lead to the mortality, that is the death can be inevitable. So time is brain, especially in the posterior circulation. As early as we recanalize and establish the flow, the recovery will be complete and the outcome will be the best. So this case, the fastest recanalization in the posterior circulation has made the best outcome for the patient. That's why we want to share and make awareness to the public regarding the time is brain, make quick decisions and make the best treatment for the prevention of morbidity as well as mortality for the patients.
ಸೊ ನೀವು ಒಬ್ಬೊಬ್ಬರು ಒಂದು ಒಳ್ಳೆ ಡಾಕ್ಟ್ರು ರೆಗ್ಯುಲರ್ ಚೆಕಪ್ ಮಾಡಿ ಲೈಟ್ ಆಗಿರಿ, ಕಿತ್ತ ಬೇಸನ್ ಬಿಡಿ. ನನಗೆ ಹೇಳಿದ್ರೆ ಕೇಳಲಿಲ್ಲ, ಇವತ್ತು ಅನುಭವಿಸ್ತಾ ಇದ್ದೀನಿ. ಅವ್ರು ಡಾಕ್ಟರ್ ಶರಣ್ ಸಾರು ಅವರೇ ನೀನು ಆಪ್ರೇಷನ್ ಮಾಡೋದು PRC ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ, PRC ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಫಿಸಿಯೋಥೆರಪಿ. ಬಡಲ್ಲ 3 ಜನ, ಒಬ್ಬರಿಗೆ 3 ಜನ ಮಾಡೋದು. ಸಂತೋಷ, ಮೇಘನಾ ಮೇಡಮ್, ಶೈಲಿ, ದೀಪಿಕಾ. ನಾರ್ತ್ ಇಂಡಿಯನ್ಸ್ ಒಬ್ಬರು ಅದರಲ್ಲಿ ಶೈಲಿ. ನಿಜವಲ್ಲ, ನನಗೆಲ್ಲ 25 ವರ್ಷ ಹುಡುಗಿ, ನಿಮಗೆ 25 ಅನಿಸುತ್ತೆ. 23 ನೋಡಿ, 23 ಡಾಕ್ಟರ್ ಆಗಿದ್ದಾರೆ ಅವರು. ನಾವೆಲ್ಲ ನೋಡಿ ಬಂದು ಮಲ್ಕೊಂಡಿದ್ದೀವಿ, ನಮ್ಮ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ತಾರೆ. ಆದಷ್ಟು ಒಳ್ಳೇದಾಗತ್ತೆ, ಏನು ಮಾಡ್ತಾರೆ. ಸ್ಮೋಕ್ ಬೇಡ, ಒಳ ಆರೋಗ್ಯ ನೋಡ್ಕೊಳ್ಳಿ. ಆಚೆ ತಿನ್ನಕ್ಕೆ ಹೋಗ್ಬೇಡಿ, ಆಚೆ ತಿಂದು ನೋಡಿ ಹೊಸ ಹೋಗಿತಾರೆ. ವೆಯ್ಟ್ ಕಮ್ಮಿ ಮಾಡೋದು 120 kg ಇದ್ದೀನಿ, 120 120 kg ಇದ್ದೀನಿ. ಎಲ್ಲ ಬೈತಾರೆ, ಹೆವಿ ಇಡಿ ಅಂತಾರೆ. ತಂದೆನ ಅಪ್ಪ ಪೇಷಂಟು, ಅಮ್ಮ ಪೇಷಂಟ್, ನಾನು ಪೇಷಂಟ್ ಆಗೋದು. ಸೊ ಆರಾಮಾಗಿ ನೀವು. ಥ್ಯಾಂಕ್ ಯು.